Hello, everyone. Okay, let's talk about a topic that, for some reason, is considered an older man's problem: prostatitis. When you hear that word, you immediately picture some guy in his 50s or 60s, a commercial for some medication on TV, a grandpa waiting in line at the urologist's office. Right? Now let me tell you something that might surprise you. Prostatitis is a condition that's showing up more and more often in guys who are 25, 30, 35 years old. And here's the worst part. When a young man comes to the doctor with symptoms, he's often just not taken seriously. Come on, what prostatitis? You're only 30. And that's where a story begins that can drag on for years. Why does this even happen to young guys? Let's first figure out why the prostate decides to get inflamed in a guy who's supposedly in the prime of his life. The first and probably main reason is lifestyle. Look at how the average man between 25 and 35 lives today. He wakes up, sits down at the computer, or drives to work where he also sits. Then he comes home and sits again, gaming, watching shows, scrolling through his phone. 8, 10, 12 hours a day in a seated position. This is normal for a huge number of people. Now imagine what's happening to your pelvis all this time. Blood circulation in the pelvic area just stops. Well, not literally, of course, but it slows down so much that tissues start suffering. The prostate is an organ that heavily depends on normal blood flow. When you sit, you're literally squeezing everything down there. Day after day, week after week, year after year. And here comes the second factor: irregular sexual activity. And irregular doesn't just mean too little. It's also when there's too much, when there are long breaks, and when there's the practice of withdrawal method. The prostate is a gland that produces secretion. This secretion needs to be released regularly. When that doesn't happen, it stagnates. And stagnation is the perfect environment for inflammation. The third thing is stress. This one is seriously underestimated. When you're constantly tense, your body reacts to it physically. The pelvic floor muscles can be in chronic spasm, and you don't even realize it. You don't feel it directly, but this spasm affects everything: blood flow, secretion drainage, nerve function in that area. How it shows up, and why it's easy to miss. Now let's talk about symptoms. And this is where it gets really interesting, because symptoms of prostatitis in young men often look nothing like what's described in textbooks. The classic picture is pain during urination, frequent urges to go to the bathroom, feeling like you haven't fully emptied your bladder. Yes, that happens. But in young guys, it usually starts much more vaguely. For example, you start noticing some discomfort in your perineum. Not pain, but discomfort. Something there feels like it's in the way, pressing, aching. Sometimes this sensation moves to the scrotum, sometimes to the lower back, sometimes to the lower abdomen. You think, well, probably caught a chill, or maybe I pulled something, and you brush it off. Or here's another common story. You notice that sex has become different somehow. Erection seems to be there, but not as confident. Or orgasm has become less intense. Or after sex, there's some strange sensation. Not pain, but something unpleasant. You blame it on tiredness, stress, lack of sleep. But actually, this could be the first warning sign. Another symptom that almost nobody talks about is changes in semen quality. You might notice it's become more watery, or the color has changed, or there's an unusual smell. This isn't something people usually discuss, but it's an important signal. And you know what's the most insidious part? All these symptoms can be very, very mild. So mild that you get used to them and start thinking it's normal. Yeah, I get this ache down there sometimes, but that's probably everyone, right? No, not everyone. And no, it's not normal. What doctors miss. Okay, let's say you did decide to go to the doctor. You come to the urologist and say, "Doctor, I have these complaints." And that's where the lottery begins. The first problem is that many doctors genuinely don't expect to see prostatitis in a young patient. They're tuned to look for other causes. Sexually transmitted infections? Let's check. Kidney problems? Let's do a kidney ultrasound. Maybe it's the intestines. Go see a gastroenterologist. And you start going in circles, getting tests that don't show anything, and time keeps passing. The second problem is standard examinations. What do they usually do? Take a urethral swab, do a general urine test, ultrasound of the prostate through the abdomen. And if they don't find anything obvious, that's it. You're free. You're healthy. Go home. But here's the thing. Chronic prostatitis, especially the non-bacterial kind, and by the way, that's the most common form in young men, may not show up on these standard tests at all. The swab is clean because there's no infection. Urine is normal because the inflammation isn't in the bladder. Abdominal ultrasound shows the prostate is fine because that kind of ultrasound simply can't see minor changes. What actually needs to be done? You need a transrectal ultrasound. That's when the probe is inserted through the rectum. Yes, sounds unpleasant, but that's how you can actually see the real state of the prostate. You need a prostate secretion analysis. That's when the doctor does a prostate massage and takes the fluid that comes out for testing. This isn't the most pleasant procedure either, but it gives way more information than just a urethral swab. And here's the third problem. Many doctors simply don't order these tests for young patients. Either they don't think it's necessary, or they don't want to bother the patient unnecessarily. And the patient goes home feeling like he's healthy, when actually the problem hasn't gone anywhere. Non-bacterial prostatitis. Now this is really uncharted territory. Now let's talk about the form of prostatitis that gets missed most often. This is called abacterial or non-bacterial prostatitis. It's also called chronic pelvic pain syndrome. What is this? It's when you have all the symptoms of prostatitis: pain, discomfort, urination problems, sexual dysfunction, but no infection is found. Tests are clean, no bacteria, and the doctor throws up his hands. Well, if there's no infection, there's nothing to treat. But actually, this is the most common form of prostatitis. According to various data, 60 to 90% of all chronic prostatitis cases are specifically the non-bacterial form. And it's usually connected to those factors I mentioned at the beginning: blood stagnation, pelvic floor muscle spasm, nerve regulation problems. And the problem here is that many doctors simply don't know how to treat this. Antibiotics? They won't help because there are no bacteria. Anti-inflammatories? They'll relieve symptoms temporarily, but won't eliminate the cause. And the patient starts going from doctor to doctor, tries different medications. Nothing really helps. And at some point, he just gives up and starts living with it. So what actually helps? A comprehensive approach. And here's where we get to what most urologists simply don't tell their patients. What actually works: first, working on your lifestyle. Yes, sounds basic, But this is the foundation. If you're sitting 10 hours a day and keep doing that, no pills will help you. You need to get up every hour. You need to walk. You need to do exercises that improve blood circulation in the pelvic area. And no, regular fitness doesn't really help here. I mean, it's better than nothing. But if you're doing a standard gym routine, bench press, deadlifts, squats, that's not what you need. You need specific exercises that work specifically with the pelvic floor and blood flow in that area. For example, Kegel exercises. Yes, those same ones usually recommended for women. But they work exactly the same way for men. This is training of the pelvic floor muscles that improves both circulation and control over these muscles. You just need to do them correctly and regularly, not once a week when you feel like it. Swimming also works really well. When you're in water, the load is distributed differently, and muscles that don't usually work get engaged. Especially if you swim breaststroke, that specifically involves good work with the pelvic area. Second, working with stress and muscle tension. This is something doctors almost never talk about. If you have chronic pelvic floor muscle spasm, no medications will eliminate it. You need physical work with these muscles. There's something called myofascial release. This is when a specialist works with trigger points in muscles, places where tension has accumulated. For pelvic floor muscles, this is done through internal massage. Yes, through the rectum. Sounds scary, but it actually works in cases where nothing else helps. There are also specialized physical therapists who work with the pelvic floor. This is a relatively new field, and there aren't many of these specialists yet, but if you find one, it can be very effective. Third, regular sexual activity. Or, if you don't have a partner, regular masturbation. Yes, I'm serious. The prostate needs to work. Secretion needs to come out. Optimal frequency is individual, but on average, 2 to 3 times a week is considered normal. Long abstinence is bad. Too frequent activity isn't ideal either, but it's better than stagnation. And an important point, avoid the withdrawal method. This is one of the main risk factors for prostatitis. When you interrupt the process, incomplete emptying occurs, and this creates stagnation. Fourth, nutrition and hydration. Nothing extraordinary here. Less spicy food, less alcohol, especially beer, more water. Alcohol causes blood vessel dilation, then sudden constriction, and this negatively affects blood flow to the prostate. Spicy food irritates everything, including the urinary tract, and water is needed so that everything gets flushed out regularly, when medication is actually needed. Okay, I've talked a lot about lifestyle, but that doesn't mean medications aren't needed at all. In the acute phase, when there's real inflammation, you can't do without medication. If prostatitis is bacterial, you need antibiotics. And it's important to complete the full course, even if symptoms disappear earlier. The prostate is an organ where medications don't penetrate well, so the course is usually long, 4 to 6 weeks. If prostatitis is non-bacterial, antibiotics won't help, but alpha blockers might be prescribed. These are medications that relax the muscles of the prostate and bladder. They don't treat the cause, but they relieve symptoms and improve your condition. Anti-inflammatories are also sometimes prescribed, along with medications that improve circulation and various herbal remedies. The effectiveness of the latter is debatable, but they help some people. But here's what's important to understand. Medications are not the solution. They're a crutch for the time while you're dealing with the cause. If you complete a course of pills and go back to your previous lifestyle, in 6 months to a year, everything will come back. The psychological aspect. There's one more thing that nobody really talks about. Chronic prostatitis isn't just a physical problem. It's a problem that hits your psyche really hard. When something is constantly hurting or bothering you down there, when there are problems with sex, when you're going from doctor to doctor and nobody can help, it's exhausting. Anxiety appears. Depression can develop. And what's worst, anxiety increases muscle spasm, which increases symptoms, which increases anxiety. A vicious cycle. That's why sometimes in treating chronic prostatitis, working with a psychologist or psychotherapist actually helps. Not because it's all in your head. No, the pain is real. But because psychological state directly affects physical state, and you can only break this cycle by working on both sides. What to do if you recognized yourself in this? Okay, let's sum it up. If you're a young man and you have any of the symptoms I mentioned, discomfort in the perineum, urination problems, changes in your sex life, don't ignore it. First step, find a good urologist. This might be difficult, but look for someone who specializes in men's health, who works with young patients, who's willing to dig deeper than standard tests. Second step, insist on a complete examination. Transrectal ultrasound, prostate secretion analysis, maybe bacterial culture. If the doctor brushes you off, find another doctor. Third step, be prepared for treatment to be comprehensive and long. This isn't a condition that's cured with one pill in a week. It's work on your lifestyle. It's physical therapy. It's possibly psychological support. And fourth step, don't be embarrassed about this topic. I know that talking about prostate problems is somehow unmanly. But you know what's really unmanly? Ignoring a problem until it becomes serious. Taking care of your health is normal. Going to the doctor is normal. Talking about your symptoms is normal. Prostatitis at a young age is not a death sentence. It's a problem you can deal with, but only if you don't pretend it doesn't exist. That's it. If you have questions about this topic, ask away. And yeah, take care of yourself.